Hello, I'm Brenon Farmer from Adobe Hills Dental again, here to talk to you about the silent disease in dentistry, periodontal disease. I say silent because most people are completely unaware they even have periodontal disease. Periodontal disease is a bacterial mediated disease, meaning there's certain bacteria that cause the disease to be active in our mouths. Now, you have a bacterial infection anywhere in your body in our society, and it is a medical emergency. It is dealt with swiftly and appropriately. But for some reason, in our society, if this bacterial infection occurs in the mouth, we seem to think, oh, no big deal, it doesn't hurt. Well, I'm on a quest to change that. And why? Why would I care about periodontal disease if it doesn't hurt? Well, periodontal disease is infecting 42% of adults aged 30 or older in the United States. 42%. Now, imagine that, 42%, but how many people are being treated for this disease? It's less than 10% of those who are going to the dentist, not the total population. So it's a small percentage who are being treated. And this disease is serious because it will increase your risk of serious health issues. You see, periodontal disease, those bacteria that initiate the disease, when their concentrations get too high in a person who's genetically susceptible, it will elicit an inflammatory response. If inflammation is allowed to be anywhere in our bodies chronically, it will increase your risk of 57 diseases. Periodontal disease is one of those 57. What else is on that list? If you have periodontal disease, you're going to have a higher risk of heart attack, stroke, diabetes, Alzheimer's, lung cancer, pancreatic cancer, arthritis, irritable bowel syndrome. The list is forever long, 56 long actually. So if you don't want to have those things, which I don't want any of those things for any of my family members or patients, then you need to address the inflammation in your gums. So periodontal disease is staged, just like cancer, from stage 1 to stage 4. Stage 1 is the most mild, and stage 4 is the most severe or advanced. As a person progresses and as the disease progression worsens, the risk of those serious health issues will increase. So treating the inflammation, the periodontal disease, to get that inflammation to go away is critical. So how do we measure inflammation in our mouths? You may have gone to the dentist or your hygienist and they went around feeling around the gums around the teeth. And what they're doing is the gums, they fold up against the teeth and they create this little ditch around the teeth. And they're measuring how deep that ditch is. If it's 3 millimeters or less and it doesn't bleed when they do that, then it's healthy. But if there's any bleeding, or if those areas get deeper than 3 millimeters, then periodontal disease is becoming active. And that is inflammation, that bleeding in deep areas. So at Adobe Hills Dental, we target those bacteria that are at the root cause of the problem. For decades, dentists have been doing, and we do at Adobe Hills Dental, something called scaling and root planing, or deep cleanings. This is where we go in and we scrape the bacteria and disrupt where the bacteria are along the teeth in those deep pockets. But we now know that if we're only doing scaling and root planing, that we are not impacting the concentration of the bacteria causing the disease to be active. So, what should be done? At Adobe Hills Dental, we do saliva testing, where we take saliva samples, send it into a lab, and they analyze it for the bacteria that cause the disease to be active. So, whatever treatment we do in periodontal disease, if it's not lowering those concentrations of those bacteria, it's not working. And if you don't know what impact you're having on the concentrations of the bacteria, you don't even know if the treatment is working or not. So salivary diagnostics, testing the saliva for these bacteria, is critical in knowing whether or not the treatment is successful. So, what's the takeaways that I want you to walk away from this short video on periodontal disease? 4 things. First, 2 out of every 5 adults in the US over the age of 30 suffers from this disease, and it's silent. You may not even know you have it. 2, periodontal disease will increase your risk to serious health issues. 3, periodontal disease is initiated by bacteria, and we know which ones they are. And whatever treatment it is, better lower the concentrations of those bacteria. Finally, I want you to know your own health. Be aware. Ask your dentist, do I have any bleeding areas? Do I have any areas deeper than 3 millimeters? So, at Adobe Hills Dental, we do this for our patients. We routinely help our patients achieve a state of health, meaning the lowest risk possible to future problems. We put this disease in remission. Once you have periodontal disease, does not mean you always have to live with those higher risks. If you treat it properly, your risks will come down to future problems, and not just dental problems, health problems. So give us a chance, give us a call, or go online and book an appointment with us on our website. Thank you.